We are now ready to make several adjustments to the remaining safe management measures. First, on mask wearing. Mask wearing on public transport as well as healthcare settings will no longer be required under the temporary COVID-19 regulations, and this will take effect from 13th February. However, mask wearing may still be a sectoral or industrial requirement. For example, the Ministry of Health, Minister Yong has mentioned, there will still, under Ministry of Health, it will still be required to wear masks for visitors, staff, and patients, particularly in indoor healthcare and residential care settings, such as hospital wards, clinics, and nursing homes. This will better protect patients and healthcare workers from infectious diseases, and not just COVID-19. On food safety, for example, SFA, Singapore Food Authority, will continue to require food handlers to wear a mask or spit guard. Private enterprises and industries may also decide to continue mask-wearing requirements for workplace safety and health or business continuity purposes. Mask-wearing remains an effective way to minimize the transmission of infectious diseases, and therefore we encourage members of the public, especially those who are unwell or who are more vulnerable, such as the elderly or the immunocompromised, to wear masks in crowded places. Second, we will adjust our measures for migrant workers. We introduced the Popular Places Pass in June last year to manage crowding in 4 designated popular locations among migrant workers on Sundays and public holidays. Now that our COVID-19 situation has improved and we are moving to DORSCON Green, we will discontinue the Popular Places Pass from 13 February. We will also align the public health measures for migrant workers living in dormitories with the updated general advisory for the community. The global COVID-19 situation has improved, with imported cases having a low impact on our healthcare system. From 13 February, all travelers will no longer need to show proof of a negative pre-departure test, nor be required to purchase COVID-19 travel insurance. That said, we will continue to keep the vaccinated travel framework in place. This will allow us to quickly adjust the risk classification of countries as well as our border measures based on the traveler's vaccination status should the need arise. MOH will also continue to screen travelers for other infectious diseases of concern, such as yellow fever, Middle East respiratory syndrome, and Ebola. We have come a long way in our COVID-19 journey. Despite the many curveballs the virus threw at us, we have managed to continue our progress in our journey towards living with COVID-19, while keeping our death rate low and our healthcare system intact. This would not have been possible without everyone's support and trust. We would like to express our deepest appreciation to Singaporeans for coming together, supporting and taking care of one another. We are also very grateful to our frontline workers, especially our healthcare workers, who sacrificed personal time and time with their families, putting yourself at risk of exposure as you care for the infected patients. Thank you for your hard work, perseverance, and your sacrifice. COVID-19 will not be our last pandemic or crisis. We must always remain vigilant and draw on the lessons we have learned during the COVID-19 pandemic so that we can be better prepared for future crises. As long as we remain united, I'm confident that we will be able to weather any challenges we face. Thank you.